I'm Nick London. I'm a specialist knee surgeon in the north of England. I have a mixed sports and arthroplasty practice. I also do a significant volume of total knee replacements and have done over the last 20 years. In the literature, up to 20% of patients are reported as being unhappy with their total knee replacement. Many patients who are unhappy with their knee replacements report anterior knee pain. At least a proportion of those patients, that's related to either an increase in the pressure compared to their native knee, or ongoing high pressure in part of the patellofemoral joint. That can be due to overstuffing the patella by not taking enough bone, or failing to balance the patellar resection, which leads to focal high pressures and therefore potentially pain. What Quadsense is trying to solve for us is a better balance, a better management of the pressures of the patellofemoral joint, with the ultimate aim of improving patient outcomes and reducing patients' discomfort and the tight feeling many patients feel after knee arthroplasty. My surgical technique for Quadsense is, after opening the knee, we do an initial conservative resection of the patella to give us a flat surface. We then put the Quadsense sensor on the back of the patella and cycle the knee through 4 ranges of movement from full extension up to beyond 90 degrees. So that is the Quadsense pressure device on a conservatively resected patella articulating with the native knee or the worn knee. And that gives us an idea of the pre-osteoarthritis state, or certainly the pre-knee replacement pressures in the patellofemoral joint. We then perform the cuts of the knee replacement. With the trials in place for the knee replacement, we then repeat the measurements with the Quadsense with the same shim in order to see any change from the pre-resurfaced femur to the resurfaced femur. Often we'll see higher pressures when we've replaced the femur. So our next step is to decide whether we take more patella and to decide whether we change the angle of the cut if we've got high pressures in one quadrant or 2 quadrants of the patella. Combined with measuring the thickness of the remaining patella, which will guide us into ensuring we don't over-resect the patella. The system allows us, before we take another cut, to not only change or micro-change the thickness of the patella, but also to simulate a change in the angle of the cut by a 2.5 degree angled shim, which simulates taking more bone off one side of the joint and less off the other. And that gives us an idea of where we go next in terms of cutting the patella. And we end up with what we believe will be a final resection to end up with what we believe will be the optimal pressure for that patient. And for patients who have no major patellofemoral or a balanced patellofemoral osteoarthritis, that may just be looking to balance or to replicate what we had with the pressures with the native knee to the pressures after the resurfacing. Another step potentially going forward is to try to reduce high pressures if they exist in a portion of the patellofemoral joint. One of the features of the system has been the cutting guide that we use for the patella. And before this cutting guide, I would always cut the patella freehand because I never found a cutting guide that I was comfortable with. The cutting guide used with the Quadsense system and the adapters appears much more stable, allows us to much more accurately cut the patella. We can change the angle of the cut and the depth of the cut from 1 millimeter increments and to 2.5 degree angles. So I've found using Quadsense has pretty seamlessly integrated into my normal workflow for a knee replacement. It's allowed me to have much more confidence in resurfacing the patella. It's certainly made me think much more about the patellofemoral joint and the concerns about increased pressure there. The system is rapid in terms of assessing pressures and delivering us options, and because the cutting guide and adapters combined with the pressure is relatively seamless, it adds at the most minutes onto the whole procedure, but does give us very valuable information that hopefully avoids us closing up a knee with very high patellofemoral pressures, which potentially leads to an unhappy patient.